My name is Gary Hagberg. I just turned 50. Had my surgery when I was 49 a few months back, and I'm been officiating high school sports in Wisconsin for 25 years, doing football and girls softball. I play way too much golf. If you ask my wife, I play golf as often as I can. I played softball my whole life. I may hang that up now, but I may not. You never know, I may go out and play again. I coached Little League baseball and just pretty much into athletics and things like that. That's it. That's what I like to do. Since 2010, I thought it was just arthritis. I was having so much pain in my hips, and I have to walk a lot at work, and I would walk and I'd turn, if somebody hollered my name, I'd turn quickly. My hip would lock, I'd want to fall, I feel like I was going to fall over. And I had days where I'm really literally walking along, holding on to handrails and holding on to boxes because the pain was so severe. I went through the cortisone shots, and I won't say that didn't help, because it did help. It only helped for so long, and then the pain came back. And I got to the point where I was tired of putting up with it, and I thought it's time to do something. It really affected my golf game, which I'm kind of passionate about. Not that I'm all that good, but I try to do the best I can, and there were shots I couldn't hit. If my feet were above the ball and I'm standing outside of a sand trap, reaching into a sand trap, I couldn't hit that shot anymore. I'd swat at it, but I couldn't hit it. And football officiating, which I love to death, and I've done it for 25 years, I was really struggling to get up and down the field. I know I'm getting older and I'm not as fast as the kids, but I shouldn't be that slow, and I just couldn't move anymore. Well, I went in with the idea that I would maybe just have some more minor surgery and have the hip sockets shaved. And when they started taking x-rays and they compared it to what I had in 2010, 2012, 2014, they found out there was no longer any cartilage left in my hips. So shaving the bone socket was no longer an option. My only option then is to live with the pain or have hip replacement. And when they offered me, I asked the doctor if I could possibly have them both done at once, and he says, it shouldn't be a problem, he'd done them before, and my success was wonderful. Actually, when I talked to Dr. Schnaubelt, he said at one time he used to do the posterior ones and he started doing the anterior, and he said a lot better success, a lot quicker recovery time, and if the way it worked for me as any indicator, yeah, the anterior is the way to go. I really recovered very quickly. My wife and I went down together down to Green Bay and sat there for about a 4 or 6 hour seminar session, whatever you want to call it, and they let us know everything that was going to happen, what to expect, what to plan for, how to plan for our rehabilitation nurses to come in. We had people come into the house only a few times. That's really all I needed. She came in and helped me with some of the rehab stuff and really did a good job, but quite truthfully, I didn't need her all that much. Not that she wasn't good, because she was, but I didn't need her all that much. She would tell me what to plan on for the next session, when she'd be here in a few days. By the time she had got here, I was already able to go up and down stairs. A week after surgery, I was doing the stairs up to my bedroom, and I was able to sleep in my own bedroom a week after the surgery. So all the information was fantastic. I had folders and folders of things they gave us that we could read ahead of time, what to plan for, even something as simple as your dental appointments. You have to make changes. You have to have special medication for your dental appointments before you go so they stop infection. I knew everything before I went in there. I went in there very, very comfortable, and what they said they were going to do, they delivered. People in the hospital, and I can't say this enough, could not have treated me better. I mean, they were absolutely phenomenal. And I bet you I saw at least a dozen different people, whether it be from nurses, doctors. There was a young lady that was she was a college student, that she was interning, and it was probably her last thing she had to do before she graduated. Absolute sweetheart, and they were just delightful. People treated me so well. I remember the first couple times trying to get up, and I'm probably whining like no offense, but whining like a little girl, because it hurt at first couple times. But they were very patient. They helped me, and I mean, for ladies that have worked in a hospital for all this time, to actually clap and give me an attaboy when I'm walking for the first time made you feel awfully good. I was there for 2 days. I had my surgery done the day before Thanksgiving, and I went home on Friday. And I was able to come home. My wife came and picked me up. My daughter was here. They helped me in the house. They put me on I sat in my chair, which is what I like to do anyhow, and they sat in my chair, and I was really fine. They kind of took care of me, but I was able to get up and use the bathroom, and within 2-3 days I was able to get in and out of my own shower, and it was pretty seamless, it really was. If you got an opportunity to go see Dr. Schnaubelt, I would go see him. And I wouldn't do like I did. I probably waited too long. There's no reason to grit and go through this pain that I went through, at least the last couple of years. Go get it done. It's only going to set you back a month or so, and you're going to be back at 100% doing the things you want to do.